Curious, setting the stakes. We tend to think of pregnancy as a prolonged state of waiting. Biologically, it is an extreme state of physical exertion. Your body is performing the metabolic equivalent of running a marathon every day, redirecting massive amounts of internal energy just to keep the pregnancy going. That heavy, bone-crushing daytime exhaustion makes perfect sense when you realize the sheer caloric output required to build a human. But that logic falls apart entirely at 2 in the morning. Every cell in your body is screaming for rest, yet you lie awake, staring at the ceiling, completely unable to sleep. This paradox starts with a specific chemical culprit, progesterone. Progesterone is the primary hormone produced by the ovaries and placenta that thickens the uterine lining and maintains the early stages of pregnancy. This timeline graph represents a standard adult sleep cycle. Progesterone has a heavy sedative quality that drags you down during the day. But at night, it actively shatters the architecture of your deep, restorative, slow-wave sleep. As estrogen levels rise alongside progesterone, the problem compounding. High estrogen stretches and intensifies the active dreaming phase of your cycle by expanding REM sleep. REM, or rapid eye movement, is the active phase of the sleep cycle where the brain processes memory and generates dreams. This expansion creates vivid, highly disturbing dreams that regularly jolt the brain completely awake. It breaks those continuous healing blocks of rest into dozens of fragmented awakenings. You are exhausted all day, then chemically blocked from resting at night. You aren't failing to relax. Your endocrine system is aggressively rewiring itself, prioritizing the biological demands of the developing embryo entirely over the mother's need to recover. As the pregnancy moves into the 2nd and 3rd trimesters, the chemical disruption is joined by a severe mechanical reality. The physical architecture of your own body becomes a hostile environment for rest. This diagram maps a cross-section of the human torso. By 20 weeks, sleeping flat on your back introduces a structural hazard. The heavy, growing uterus physically compresses the inferior vena cava. The inferior vena cava is the primary abdominal vein responsible for returning deoxygenated blood from the lower half of the body back up to the heart. When that flow is choked off, blood return drops, and the body forces you awake to fix the problem. The exact mechanical countermeasure required to relieve this vascular pressure is shifting to your left side. Gravity pulls the uterine mass downward and away from the spine, instantly unpinching the vein and restoring upward blood flow to the heart. But the mechanical failures aren't limited to circulation. The uterus also grows upward, elevating the diaphragm by roughly 4 centimeters. This upward pressure drastically reduces functional residual capacity. Functional residual capacity is the volume of air left in the lungs after a normal, passive exhalation. With the lungs compressed, lying flat triggers a suffocating feeling of breathlessness. Because your internal geometry is so compromised, you have to artificially recreate proper alignment. External structural interventions, like rigid wedge pillows to elevate the chest and U-shaped body pillows to separate the knees, are the only reliable way to manage the shifting gravity and preserve lung capacity. Surviving this biological and structural disruption requires building a targeted sleep stack, a specific sequence of environmental and chemical fixes to hack your broken rhythms. It starts with temperature. To initiate the onset of sleep, the human body needs to cool down. Pregnant women operate with a drastically increased blood volume and a higher baseline metabolic temperature. Forcefully dropping your ambient room temperature to 65 degrees Fahrenheit provides the heavy thermal contrast your nervous system needs to power down. From there, you can introduce safe chemical interventions to neutralize specific symptoms. Adding magnesium glycinate before bed serves as a dual-threat solution. Magnesium glycinate is a highly absorbable mineral supplement that calms the central nervous system, preventing the severe muscle contractions causing nighttime leg cramps. Cautionary: this diagram models a neural pathway reacting to a common antihistamine. When exhaustion peaks, it is tempting to reach for over-the-counter sleep aids like Benadryl. But these active ingredients, specifically diphenhydramine, act as a trap for pregnant women. As the molecule locks into your receptors, this sedating antihistamine actively triggers or severely worsens restless leg syndrome. Restless leg syndrome, or RLS, is a neurological condition that creates an irresistible, crawling urge to move the legs while resting. The antihistamine throws gasoline on the fire, but the root cause of severe pregnancy RLS is the sudden depletion of maternal iron and ferritin levels. Ferritin is a blood protein that acts as the primary storage tank for iron inside your cells. When that tank empties, the nerves in the legs begin to misfire continuously. Treating the underlying iron deficiency is the actual biological cure for the twitching. You cannot force the body to rest with blanket sedatives. They accidentally weaponize your own nervous system against you. Treating pregnancy insomnia requires surgical precision, lowering the heat, replacing the missing minerals, and supporting the physical structure. By the third trimester, the physical discomfort combines with a psychological battleground. The absolute silence of nighttime removes all the distractions of the day, amplifying every trace of anxiety about the upcoming birth, the baby's health, and your entirely new life. To protect your sleep environment, you have to externalize that mental load. The brain dump mechanism requires physically leaving the bedroom, sitting in dim light, and writing down every anxious thought in a notebook. You have to break the conditioned association between lying in bed and hosting a racing, panicked mind. If you stay in bed staring at the clock, calculating how few hours you have left before the alarm goes off, you fall into a trap known as sleep effort. Sleep effort is a clinical term for the anxious, desperate attempt to force yourself to fall asleep. Trying hard to sleep is the exact mechanism that guarantees you will stay awake. Sleep effort acts as a potent psychological stimulant. It floods the body with cortisol and locks your nervous system into a hyper-aroused sympathetic state. You are treating sleep as a high-stakes performance, and your body reacts to high stakes by remaining alert. This chart illustrates two separate brainwave frequencies stacked vertically. If you are lying awake panicked that your insomnia is harming the baby, you need to know about the ultimate biological firewall. The baby's sleep architecture is entirely disconnected from your own. Even when your brainwaves are erratic and panicked, the baby's sleep remains perfectly slow, rhythmic, and completely immune to your insomnia. The sleep deprivation only affects you. Chasing 8 perfect hours of uninterrupted sleep during pregnancy is a mathematical impossibility. The solution is radical acceptance. Radical acceptance is the psychological practice of acknowledging a difficult reality without judgment or attempts to fight it. Surrender to the temporary biological chaos. Optimize your temperature and alignment. Accept that you are awake and you recognize that simply surviving the night is a victory in itself.